Hi, it's Elrina from Fleet Physio and Wellness, and you are complaining about tightness in your upper back and sometimes neck. So the first two things to remember about tightness in the upper back and neck is that it's often linked to your posture and your breathing. So remembering and checking back on the video on posture, getting that alignment of the pelvic bowl, not pouring water out the front or the back, the ribs kind of sitting as a lid on top of the pelvic bowl, but the most importantly, getting the head position right so that you can see your chest and your peripheral vision. What that will do is deactivate the upper traps. So when we get tightness in the upper back, it's often because we're living in that kind of state. So we're forward and closed in the front and too open in the back, which inhibits the muscles of the lower and upper back, but also overactivates these muscles here. So getting the head in the right position so you're completely balanced with your head on top of your neck and shoulders, and you can see your chest is an important thing. Now, if you're already short and tight, it could be quite hard to get that position. So the exercises we're going to run through today will actually help to get the head and shoulders in that position where your shoulders are hanging loosely down the back, and your head is sitting nice and central. The second thing to remember is that if you've got poor breathing patterns and you suffer from anxiety, you're going to breathe up here. So really focusing on a breathing practice where you're belly breathing or rib breathing or both is really focusing that air coming down and out rather than sitting up here where we're not using the full lung capacity, but also setting ourselves up for a fight and flight situation. So you're constantly kind of ready to go, but that's not where we want to be living. So have a daily breathing practice, even if it's just 3 minutes of just stopping for 3 minutes and doing some deep nose breathing right down into the belly. Get that belly to expand, get the ribs to expand, and a full exhalation either through the nose or mouth. The more important thing is breathing in through the nose. So once you've got the posture and the breathing sorted out, you're still stuck with a very tight upper back and sometimes tight neck as well. They tend to go hand in hand. So we're going to show you a couple of techniques today that will help to switch on certain muscles, switch off certain muscles, and also mobilize the things that need mobilizing. So the first thing we're going to start off with is the roller. So the one I recommend is TP roller. You can use whatever roller, and even a rolled up towel will be fine. But you want to use this in the kind of mid-back area. So you can use a couple of techniques. You can just roll up and down on it and you'll feel a couple of crunches and cracks going on. But if you want to be more specific with the areas that you're working on, you want to start with it around the bra strap area, or if you're a bloke, wearing it around the heart rate monitor area. So you see where I am there. The key thing here is not to just let my back go. I want to make sure that my abdominals are engaged, almost a bit like you're pulling your ribs to your hips. And you're going to keep that engagement the whole time. You can support your head, not pulling on it, just supporting it, and breathing in to prepare, breathing out to lean back as far as you can go. And you can breathe in as you come up, roll a little bit further down the roller, and go again. And you can do as many of these repetitions, and you can do a couple of breaths in the position as well, as long as you're keeping your lower back as close to the floor as possible. And then you keep going on all those tight spots and just releasing back. And you can see my lower back is as close to the floor as I can get it. I'm not just arching over, I'm keeping that tight and closed. And you can go up or you can go down. The further down you go, the less likely you are to be able to keep your lower back on the floor. That's okay, as long as the intention is still there. So a couple of breaths on each one, a couple of repetitions on each one, and you'll feel that release happening. So that's your roller, which is obviously useful for so many other things. The next one is a cat and camel, but it's slightly different focus on this one, because you're going to have your hands, instead of in your normal kind of box pose with the hands underneath the shoulders, you're going to bring your hands right close to your knees, so that you can get the arch through the upper back when you're doing it. So if you look at what's happening there in my upper back, as opposed to the amount of movement that's happening in my lower back there. So your normal cat and camel is for the lower back, and the kind of short cat and camel is for the upper back. So you're really focusing on getting your sternum up towards the ceiling and down towards the floor. using the head as well to increase the movement. And you can do 10 or so movements there. And while you're in this position, you keep your knees above your hips and knees in alignment, and you're going to walk forward into puppy pose. So this is different from your child pose because your bum stays up. And you can be in child pose, which again mobilizes the upper back, rather than child pose that mobilizes the lower back. So you're just there. You can do a few breaths there. I like to do 4 breaths in every position. And then you can move your arms to one side, so you get a stretch on the lats. And again, your 4 breaths, and to the other side to stretch out the lats on the other side. These are very important postural muscles. Then stay in that puppy pose position, doing a thread the needle, where you bring your shoulder to the floor, and I like to use this hand to further push myself around through the upper back. 4 breaths. Take the other hand, shoulder to the floor, and keep pushing through so you get that rotation through the upper back. And 4 breaths there. So that will already feel significantly better in terms of upper back mobility. But now we've also got to think as to, if these muscles are overactive and tight, we have to activate the muscles that actually keep your shoulders back and down. And for that, your dumb weight is the best exercise. Now, I prefer to do this against a wall, but you can just do it sitting up, and you can do it with or without a band. So just holding an imaginary tray and taking your arms out as far as they'll go on the out breath, keeping the shoulders down, keeping the head in alignment, coming back in on the in breath, breathing out as you go out, elbows stay tucked in, breathing in as you come in. Now you can combine this with a pelvic floor contraction, with a bit of a breathing exercise, in through the nose, out through the mouth. Or you can use a band wrapped around your hands, keep your palms flat and pull the band out. What will most often happen here is you tend to turn the hands that way so you can start cheating. You want to keep your hands flat to the ceiling and move out that way. I would do 10 repetitions there. Then you can do some pec stretching, which you can do up against the wall or in a doorway, which will get the front of the shoulder mobilized. I like to just put my arm against the wall, flat elbow, and palm against the wall, and just twist away so you feel that deep stretch through there. 4 breaths in that position, in through the nose, out through the mouth, deepening on the out breath, and then the same to the other side. So flat hand, elbow, shoulder height, and just twist the body around. Use your 4 breaths there. And then last but not least, some neck stretches. I've got a whole video on neck exercises and neck stretches, but I'll just give you an idea in this little video. So your hand comes to your opposite ear, sit on that hand, either hand that way or hand that way, whatever feels more comfortable for you, and pull your ear to your opposite shoulder until you feel a comfortable stretch. That shouldn't be more than kind of 5 or 6 out of 10 in terms of discomfort or stiffness. If you need to back off, back off. If you feel you want to, something I find really effective is actually pushing into the hand. So your head is going that way and you are pushing in as you breathe out and releasing on the in-breath. And then pushing as you breathe out and releasing on the in-breath. And you can do as many of those as you want to both ways. From there, just take your nose to your armpit. Your hand will now end up behind your neck. Make sure the shoulder stays down. Nose is aiming to the armpit. Stretch there, either holding for your 4 breaths, or if you want to be more effective, pushing on the out breath. So you're pushing that way into the resistance of the hand and breathing in as you go down, pushing as you breathe out, breathing as you go down, pushing and releasing. And then don't forget to do the other side. So there and there. So that will give you mobility, stability, and less discomfort. So I hope that's helpful. Please let me know if you have any questions, and I'll get back to you as soon as I can. Thanks for watching.